Good morning, people, and welcome to today's presentation. So, in today's lesson, we are going to look at how to nurse a patient with congested cardiac failure. So, guys, congested cardiac failure is a condition that affects the cardiovascular system, in which the heart myocardium fails to pump blood effectively enough in order to meet the body requirements. So in today's lesson, we are going to look at how to nurse a patient with heart failure. So let's proceed to our lesson. So in this lesson, we are going to look at 5 problems that a patient with heart failure is likely to have. And the first problem that we've identified is dyspnea. At this particular time, I'm sure you are familiar with how to write a nursing care plan, how to draw it. So it's supposed to have these columns and written as it is indicated here. So you need to have your date, your time, your problem identified, your nursing diagnosis, your aim or your objective, your interventions, your rationale, and your evaluation of the expected outcome. So it's supposed to look like this. So now let's start our first problem. So the first problem that we've identified is dyspnea. And the nursing diagnosis is that the patient is likely to have difficulties in breathing related to failure of the heart to pump blood effectively enough to meet body metabolic needs evidenced by rapid respirations. And our objective is that at the end of our interventions, the patient will be relieved from dyspnea, which will be evidenced by respirations of 16 to 20 breaths per minute, which is the normal range. So our interventions are that we should nurse the patient in forest position, and the rationale is that to promote adequate lung expansion. So we are nursing our patient in forest position to promote adequate or full lung expansion, and we can do so by use of a backrest. So the next intervention is that we are going to monitor oxygen saturation levels using a pulse oximeter or a cardiac monitor. So we are going to nurse this patient on a cardiac monitor. In a situation where there are no cardiac monitors, we can simply use a pulse oximeter to monitor the oxygen levels. So the rationale is that we want to ascertain the level of oxygen in the body tissues. Then the next intervention is that we are going to administer oxygen therapy via a mask or a nasal prong. So administer oxygen therapy via a mask or nasal prong according to the doctor's orders to promote tissue perfusion and to help the patient breathe easily. Then the other intervention is that if the patient is unconscious, we have to nurse the patient with the head on one side. So why are we doing so? To clear the airway by promoting drainage of secretions. So if the patient is unconscious, we are going to nurse them on one side so that in case there are any drainages, any secretions, they drain through the nose so that the airway is cleared. And our expected outcome is that the patient will achieve relief from dyspnea as evidenced by stable breathing. So this is our first problem which we have identified. So the second problem is as follows. The second problem is edema. So the nursing diagnosis is that the patient is likely to have edema or fluid volume excess related to decreased cardiac output evidenced by edema and weight gain. Also, there can be evidence of ascites. So our objectives or our aim is that the client or our patient will achieve adequate fluid balance, which will be evidenced by reduced edema and a normal body weight. So that's our aim. So our interventions as follows. We are going to monitor the patient's weight daily. So daily body weight monitoring is going to be done. The rationale is that we want to assess if the patient weight is reducing or not, so that appropriate measures are taken. In this case, if the patient is reducing weight, it will tell us that the patient is improving. While if they are not reducing their weight, it means the patient is not improving and they are not responding to the treatment. So the second intervention is that we are going to restrict salts or sodium intake diet of 60 to 100 millimoles. So why are we doing that? Why are we reducing sodium intake? Is that we want to curb fluid overload. As we know, if the patient is taking in a lot of sodium or salt, they are likely to have to be also drinking a lot of fluids, a lot of water. So this can result in worsening the condition because the patient already has excess fluids, and if we also encourage them to be taking a lot of fluids through the intake of sodium, it will worsen the condition. So we have to restrict salt intake, and we also have to educate the patient or the client the importance of reduction of salt intake. So the next intervention is that we also want to restrict fluid intake. We want to restrict fluid intake in order to prevent further fluid volume. So the other intervention is that we are going to administer the prescribed diuretics such as furosemide or Lasix. Why are we doing so? We want to promote elimination of excess fluids, which will also help in reducing the body weight. Then the other intervention is that we have to monitor the IV, which is the intravenous intake, and we also have to monitor the urine output. So if we are administering intravenous fluids, we have to monitor how much the patient is taking in and how much urine they are producing. So by doing that, we are going to ascertain the progress, and we are going to rule out renal failure. So our next problem is that the patient is likely to have high risk of skin impairment. The nursing diagnosis is that skin impairment is related to reduced tissue perfusion, edema, and inactivity. So under our objective or our aim is that our clients will be free from any form of skin injury throughout hospitalization. And our interventions as follows. We are going to observe the patient for any signs of pressures or formation. So we are going to be monitoring the patient's skin to observe if there's any sign of pressures or formation. And why are we doing that? Is that we want to notice if the patient's skin is intact. If not, we are going to manage accordingly. So the second intervention is that we will be turning the patient to hourly. That is, if the patient is unconscious and if they are unable to move on their own, we are going to be monitoring them. We are going to be turning them every after 2 hours. Why are we doing so? Under our rationale, we want to relieve pressure from the pressure points, thus reducing or preventing pressure sore formation. So then we are also going to provide protective devices such as earring or a pillow on pressure points. Why are we doing so? It's because we want to relieve pressure from the pressure points. Then our fourth intervention is that if the client is able to, so if the client is fully conscious, if they are able to make movements, we are going to encourage them to be moving in and out of bed to promote blood circulation. Then our last intervention is that we are going to provide lubricants for the skin, such as Vaseline, to prevent dryness of the skin so that we avoid skin injury. So the third problem that we identified is that patient is likely to have anorexia. Patient will have anorexia, and under our nursing diagnosis is that the patient will have anorexia due to or related to lack of strength due to restricted diet, toxicity, and ascites, which is evidenced or which can be evidenced by verbalizing. So the patient will be failing to eat due to lack of strength. And as we discussed earlier, we said the patient is going to have a restricted diet in that you are going to reduce salt intake. So that also can contribute to a patient not wanting eat to eat accordingly. So under our objectives is that we want our patient and our clients to have increased appetite so that they'll be able to eat. So under our interventions, we are going to give small but frequent meals according to the patient preference. This is done to promote food intake. Then you are going to provide oral care. So oral care has to be done in order to promote salivation and promote appetite. Then if the patient is unconscious, we have to insert a nasogastric tube for feeding and to promote food intake. Then we are going to be monitoring the blood glucose levels. Why are we going to be monitoring blood glucose levels? We want to rule out hypoglycemia. And also we are going to administer drugs such as multivitamin as prescribed by a doctor to promote appetite and food intake. Then also we have to make sure that our environment is free from anything that can interfere with the patient's appetite. Anything that can make the patient to vomit in the environment, we have to remove them to prevent vomiting, nausea, and anorexia. And under our evaluation is that at the end of our interventions, our patient nutrition status will be improved. Then our last problem that we identified is that of anxiety. So the patients with heart failure or congested cardiac failure may have anxiety. So the nursing diagnosis is that the patient will have anxiety related to lack of knowledge about the condition and the fear of death, which can be evidenced by client asking too many questions. So our objective is that the client will experience a reduction in anxiety and will be calm. So under our interventions, first and foremost, we have to educate the patient on the condition in simple terms. This is done so to promote understanding. So the patient should understand their condition. So, and it's our duty for us as a nurse to make sure that they understand. So the other intervention is that we have to explain the patient's we have to explain to the patient every procedure before doing it, such as the oxygen administration, and we have to do so in simple terms to reduce anxiety and to promote cooperation. So if the patient do not understand why we are doing a certain procedure or why we are commencing them on oxygen, they may not cooperate. But when we explain to them, they understand, they can easily cooperate. Then the other intervention is that we have to involve patients' relatives in their care, such as the wife, the husband, or the children. We have to involve them in their care to prevent social isolation. Then also we want to allow the clients to ask any question or express their concerns about their condition, and we have to respond in a calm and explain in simple terms so that they understand their condition. And under our evaluation is that at the end of our interventions, the client will experience reduction in anxiety, which will be evidenced by a patient being calm and not asking questions because they have understood. So this is the nursing care plan for a patient with congested cardiac failure. So this is part A, or the first part of it. In the next lesson, we are going to look at part B of the nursing care plan of a patient with the heart failure. Thank you guys. I hope that you have enjoyed and learned one or two things from this discussion. For any questions or contributions, please feel free to write in the comment section. And if there is any topic that you want us to look at, you can also write it under the comment section. Thank you so much. Please make sure you subscribe to the channel, like and share the video. Thank you so much.